care of the patient with problems of HIV disease. You see here your student outcomes. I will not take the time to read them to you. We're going to be looking at collaboration with the interdisciplinary team. We're going to be looking at preventing HIV transmission to healthcare providers. We're going to look at health promotion maintenance. We're going to look at community resources, assessing all adults who are at high risk for HIV. We're going to be looking at nursing interventions to assist both the patient and family to cope with an HIV diagnosis. We'll be looking at signs and symptoms and laboratory values to assess for impaired immunity. And we'll be teaching both the patient and caregiver about some of the common drugs used with HIV disease. Here we have a very brief pathophysiology review. To infect, HIV must first enter the host's bloodstream, and then it hijacks cells, especially the CD4 and T cells. The T cells and CD4 directs immunity and regulates the activity of all immune system cells. When HIV enters a CD4 T cell, more virus particles are created. Virus-host interactions are needed after infection for the disease to develop. Virus binding to the CD4 receptor and to either of the co-receptors is needed for HIV to enter the cell. HIV particles are made within the infected CD4 plus T cell using the metabolic machinery of the host cell. Please keep in mind that everyone with AIDS has HIV, but not everyone with HIV has AIDS. Soon after the HIV infection, our immune system can still attack and destroy opportunistic infections. Medication will slow the process, but over time, the number of HIV particles will overwhelm the system. What determines when an HIV infection becomes AIDS? Well, it is related to the number of CD4 plus cells the patient has and whether or not the patient has had an opportunistic infection. As of December of 2020, an HIV treatment has dramatically improved. The CDC now says that over 80% of people with HIV were virally suppressed at their last doctor's appointment. People living with HIV can infect others at any stage of the disease. With that being said, people living with HIV who are on antiviral therapy or ART therapy can get and keep undetectable viral loads and effectively have no risk of transmitting HIV to their HIV negative sexual partners. This does not say that they should not continue to have safe sex. This is only if they were in a monogamous relationship. Please refer to the CDC fact sheet that is listed at the bottom of your screen. Here, as you can see from the fact sheet, it will tell us about the ART therapies, and that again, with the development of these ART therapies, it has transformed the way we have approached HIV prevention. This vision is a focus core of the CDC's high-impact HIV prevention strategy. The only thing I really want you to understand is that we now have the ability, if patients are on ART therapy, that they do not infect their monogamous partners as long as their viral load has reached 0 or non-detectable. Although our textbook does not mention the HIV continuum, I wanted to bring it up because it is the way the CDC organizes their information. The continuum is the series of steps from the time a person receives a diagnosis of HIV through the successful treatment of their infection with HIV or ART medications. Again, we'll look at the CDC website. Here you see the understanding of the HIV continuum. As you can see, I've pulled up where it says the HIV care continuum. It is the HIV care continuum consists of several steps. You have the diagnosis, then you have the person who has newly been diagnosed with HIV being linked with care, then receiving and retaining care, and lastly, being able to be virally suppressed. Now, back to the PowerPoint. Although these objectives were for 2020, they remain the same today. The goals are to increase the number of HIV individuals aware of their status, increasing proportions of newly diagnosed HIV to be linked with care within 1 month, and increasing the proportion of HIV diagnosis individuals to be virally suppressed to up to 80%, as we are aware that we have now reached the goal of over 85%. I left this slide in order to show you that how far we have come. Now we know that people diagnosed with HIV who are virally suppressed are at 85%. That is a 20% increase just since 2018. That's the reason I left this slide here, was to show you the magnitude of how far we've come with HIV diagnoses just in a very short period of time. Recommendations for HIV screening. One-time screening for all persons between the ages of 15 and 65. An annual screening for high-risk groups. A prenatal screening for those who are pregnant. More frequent testing for adults with repeated high-risk exposures. You are responsible for the chart on page 327. Again, you are responsible for the recommended screenings on the chart on page 327. Health promotion and maintenance. HIV is transmitted 3 ways: through sexual relations such as oral, anal, or genital; parenterally, through shared needles. This is also how healthcare workers get HIV, by being stuck with a dirty needle or sharp; and perinatally, when it is transferred from mother to neonate. Pre-exposure prophylaxis, or PrEP, is the use of HIV-specific antiretroviral drugs in a person who is not infected with HIV. The purpose of PrEP is preventing HIV infection. The approved drug combination for PrEP is listed below. Please make sure you look at the drug alerts on page 328. Patients or people who have infections with hepatitis B should monitor kidney function prior to starting PrEP therapy. Please keep in mind, and we should educate our patients, that PrEP therapy or PrEP, prophylaxis does not replace safe sex practices. PrEP should be used for individuals who are not infected with HIV but are in a monogamous relationship with someone who has HIV. Post-exposure prophylaxis is given for occupational exposures such as needle sticks, exposures to non-intact skin or mucosa. Keep in mind that standard precautions is our best prevention. Preventing transmission to healthcare workers is also listed for us on page 330. It's all about your PPE and making sure that we continue to use safety practices that are in place in facilities. Other post-exposure prophylaxis is needed for consensual unprotected sex, sexual assault. The treatment for post-exposure prophylaxis is listed for us in figure 17.4 on page 329. Please make sure that you take time to look at this. Again, that is figure 17-4 on page 329. HIV classifications. The big thing here is to remember is it's all about viral load. Viral load is the amount of virus present in the blood and other body fluids. Remember, if a patient's viral load is undetectable, they in general cannot pass HIV infection onto their sexual partners.